Hi everybody, welcome to another episode of Sessions with Paola, and today I am so excited to have Dr. Lina Haji, a licensed clinical and forensic psychologist and just an amazing human being. I really like Dr. Lina because her style is very real and she's like, let me tell you the truth about this. But let me introduce her. So Dr. Lina specializes in psychodiagnostic assessment, forensic assessment, dual diagnosis, serious and persistent mental illness, depression, anxiety, personality disorders, and substance abuse treatment. She has over 20 years of experience and has worked in inpatient and outpatient settings, including correctional facilities, substance abuse and rehabilitation centers, psychiatric hospitals, and she has done private practice in 4 cities: New York, New Jersey, California, and now Florida. She has an extensive amount of education and training, and her goal is that regardless of population, is to accurately diagnose and identify patients' strengths and areas of growth in order to better individualize treatment needs and goals. We are so lucky to have Dr. Lina practicing here in our neighborhood. And Dr. Lina, welcome.
Thank you so much for having me, Paola. I'm very excited to be here.
Yes. And I think, one of the things that I love about Dr. Lina, so she does this little segment in Misdiagnosis Mondays, which she really talks about some of the myths that we have around some diagnoses, because we are in a time in this world where there's just so much information, and the news and the media defines a lot of things for us. So I just love someone that can really, bring us the myths and bring her wise energy and her knowledge to really tell us how it is. And she tells us how it is. This is why I love her. So guys, today we're going to talk about one of these diagnoses, which is sex addiction. And I put it in quotation marks because in my field of sex therapy, we see it more as sexual compulsivity. And we heard this many years ago. I think Tiger Woods, Charlie Sheen, what's other names?
Eric Benet, Halle Berry's ex-husband, he had sex addiction. There have been quite a few. I can't think of them. But yes, it's definitely more prevalent in the last few years, for sure.
Yes. And Dr. Lina, tell us a little bit, what are your thoughts about the diagnosis of sex addiction?
So my first thought is, to be brutally honest, anytime I hear somebody say that they're a sex addict, my first thought, full transparency, is kind of to roll my eyes. And I'm aware of that, right? It's like, no, you're responsible for your own behaviors. That's ridiculous. However, there is a lot of research and evidence that shows that there is a component in people, and as you mentioned, a compulsivity, an impulsivity to engage in these kind of behaviors, and it really gets to a place where it ruins people's lives. It ruins their functioning, their work life, their home life, their mental health, their physical health, STDs, all sorts of things. But also, I should point out that it is not in the DSM-5, the Diagnostic Statistic Manual of Mental Disorders, or the DSM-5 TR, which just came out. However, it is in the ICD-10, which is published by the World Health Organization, ICD-11, as a compulsive disorder, as an impulsivity disorder. So it's very interesting that it's in one of our kind of diagnostic Bibles, but not in the other.
Yes, and I wonder, what would you say, right, are the biggest misconceptions about people who either self-diagnose as I'm a sex addict, or I think my partner is a sex addict?
I think the problem with self-diagnose, anytime anybody self-diagnoses, it's a problem, because you can't look at yourself objectively in too much, right? So it's always important to have a licensed mental health professional take an objective view when it comes to any diagnosis. Also, the term addiction, when we think of addiction, we think of substances, drugs, alcohol, gambling, nicotine, things like that. However, the reason that there is so much controversy with sexual addiction is because a lot of planning usually goes into it. Whether you're on dating sites, or you are hiring prostitutes, or however you're getting to have the sex, there's a planning component. And so a lot of researchers disagree with the fact that it's impulsive and that it's compulsive, because there's a planning. Yeah, and I find that very interesting too, because at the same time, it can be viewed as an addiction because people are looking for that high, that oxytocin release from orgasms and sexual pleasure, and it's satisfying a need. So going back to your original question, I think it's dangerous for anybody to self-diagnose anything, but can there be an addiction to sex? Absolutely.
Yeah, and I think, Dr. Lina, in my practice, right, what I see, I went to this conference, they do a lot of research around sexuality, and one of the things that they shared, they were talking about porn addiction, men that self-identify as having an addiction around porn. And what they found is, first of all, these men were using porn over 7 times per week, but there was hypersexuality, susceptible to boredom, depression, and low self-worth. So I want you to maybe share with us, what do you think are some of the risk factors that maybe play into someone, developing this type of addiction or compulsivity, impulsivity? What are your thoughts about that?
Thank you for asking that. I think that's really interesting. And also, I think watching porn 7 times a week is probably pretty low. I mean, I know a lot of people who I wouldn't consider pathologically addicted to sex who watch porn 7 times a week. I think the important part when you're looking at a diagnosis or if it's is whether it's interfering in your life. And so are you watching so much porn that you are late to work, that you are unable to function, that your marriage is taking a toll, that you are desensitized to being intimate with your partner, that it's really impairing your functioning as a human being, that you're constantly thinking about it, or that you're acquiring, sexually transmitted diseases and infections. So we really want to look at the functional part and how it's impacting your life. But you also brought up using sex as a coping skill. And there's a lot of research around that as well, because if somebody has depression or anxiety or low self-esteem or any, so many different disorders or symptoms that people deal with, of course, sex is a very quick feel good. And so it will get you out of that depression or out of that anxiety or out of that boredom or make you feel self-worthy for at least that short amount of time. The problem is, just like any other addiction, you get the immediate gratification, but then reality sets back in. And so it's that cycle.
Yes. And I think, you guys, because it's so interesting that you say that, because I've had clients where, I have a lot of calls and people call me and they say, oh my God, I'm masturbating and I'm masturbating once a week. And like you said, well, once a week, every day, maybe not a big issue, but maybe there's religious components. They feel really guilty. But then I've had clients where haven't treated their depression, a lot of childhood trauma, and they found masturbation as a way to, again, relieve that depression just momentarily, and then they spend hours masturbating, hurting their shaft, right? Almost just, there's this, I can't stop and I'm gonna continue going. And like you said, it's a temporary quick fix, but it doesn't really, there's no real solution to the problem.
Right, it's not addressing the underlying issue. And I've had patients like that too, especially in correctional facilities, which would make more sense since there's no access to, intimate partners typically. And so, the masturbating to the point that they're literally chafing their hands and they're hurting themselves and it's a compulsion. And also you mentioned childhood trauma. So again, using porn or sex with other people or masturbation or anything that's sexual in nature, there's nothing wrong with that. We are all sexual humans, but when it becomes pathological, when again, it's hurting your life or hurting you in some way. And that's the clear distinction that we need to make. Is it affecting you negatively? And you mentioned guilt and shame. That's something I've seen as well, where somebody will engage in masturbation and they'll feel fine and go about their way. But then you have people engaging in masturbation and for whatever reason will feel shameful and guilty and something is wrong with me. So really getting a full picture of the individual and teasing out all of those other factors to see if it's indeed a problem or an addiction, so to speak.
Yeah, and something I saw, Dr. Lynn, in my practice, when the pandemic hit, right? A lot of my guys were struggling because strip clubs, right? Everything was closed. So, when we think a little bit about fear of rejection, it's also coming up for me. And so when you go to a strip club, it's like you don't have to deal with, let me talk to you. Are you going to reject me? How is this going to feel? Things just kind of happen. And so a lot of people ended up oh, wow, is there something here? Because then they started showing symptoms of depression, of am I worthy? So it's really interesting. I mean, we still, I think, as clinicians, are still picking up the pieces of what the pandemic has done. But to your point, I've had clients that have gone fired from jobs because they're watching porn on their job, right? And or they see an attractive woman, they're driving to work or they're driving home and they see an attractive woman and they have to follow that woman because they just want to look at them a little bit longer, or, kind of a little bit of voyeurism or exhibitionism. So I think that there's so many things to think about. And I've had guys that just with trauma, right? Some people use fantasy as a way to survive really traumatic situations in their childhood. So I've had, adults that as a boy, they found a Playboy magazine, or they found out how to masturbate, or they started fantasizing about their adult teacher. And this becomes something bigger. It may not, but given the trauma, there's a lot of layers that we need to think about. We need to think about context for this to actually develop. Do you think, Dr. Lina, have you seen also women being sexually addicted? Can women also, fall into sexual compulsivity, sexual addiction?
Yes, absolutely. And you bring up so many good points. I think that, the prevalence rates that we have so far show that men are more likely to develop sex addiction than women, but women are absolutely not exempt, and for the same reasons. Maybe they have a trauma history or depression. It's their only coping skill. Self-esteem is a big one. If somebody wants to be intimate with you, even if there's no emotional intimacy, but there's a physical connection and you can both orgasm or get some sexual pleasure out of it, then that feels good. It is what it is. It feels good, and you're going to want more and more and more. So women are absolutely susceptible to that as well. And like you mentioned, I see a lot of women with trauma histories who also, not just for the gratification, just for the sexual gratification, but as an escape, like the sexual fantasies you were talking about, as an escape, as a way to desensitize themselves. And it's just like any other drug. Your tolerance level builds up and you need more and more and more. Somebody might do heroin, a small bag on a Friday, but 2 weeks later they're doing 10 bags a day. It's very similar in that respect, and that's why I'm not completely opposed to classifying it as an addiction, because there definitely is that tolerance level that builds up in individuals needing more sex, more porn, and then it may cross that line into a paraphilic disorder or a sex offending, and that's a dangerous area.
Yeah, Dr. And I always find this super interesting. I know that you talked a little bit about, and you and I talked about it, working in correctional facilities, right? And I'm wondering, isolation. I think the pandemic also made us realize, what isolation does, right? And I couldn't help but think about people that are in our jail system and how that affects them. How do you think that plays a role? I don't know if there's anything there that comes up for you, isolation and how that increases, maybe not even related to sex, but any type of compulsivity or impulsivity.
Absolutely. I mean, the pandemic really showed us a lot of things. We learned so much. And I think what it boils down to is that at the core, we are social beings. We need social interaction. We need friends and family and people to talk to and laugh with. And we weren't able to do that during the pandemic for quite a long time. So if you translate that over to populations that are in jail and prisons, they have to deal with that all the time, every day. And which is another reason that you see a lot of drugs in prison. People think, oh, there are no drugs in prison. You're locked up. How can you possibly have drugs in prison? Make no mistake about it, there's so much contraband in prisons, it's not even funny. I've even had inmates, I digress a little, but I've even had inmates come into prison without a substance abuse addiction and leave prison with a substance abuse addiction because they don't have the coping skills to deal with the lack of interpersonal interaction, not having sex, not talking to humans, being isolated all the time. So it makes complete sense that us as humans being more isolated during the pandemic would turn to sex or drugs or alcohol, but same thing in correctional facilities. I mean, inmates aren't supposed to have sex, but it happens all the time, and probably more than we care to admit. And we don't address it. We don't talk about it.
I know, and we could probably talk about this. we could probably have so many discussions here now. Dr. Lina, if somebody is kind of thinking, ooh, do I have a sex addiction issue, or I'm seeing that maybe I'm using it compulsively, maybe over 7 times per week or whatever, maybe what do you think are some good steps or beginning steps that they can take in order to start addressing their sex addiction?
I think that if somebody is starting to feel like, something's off, this is a little too much, or I don't feel comfortable with this, I would suggest first thing going to a licensed mental health professional. I love psychiatrists, but I'm going to say not first a psychiatrist, because they tend to prescribe, and then we're not getting to the underlying root of the problem. I'm all for prescription meds when needed, but I would say, a therapist or a psychologist, and really have an evaluation so that that individual can have a breakdown of everything we've talked about. Is there a trauma history? Are you dealing with depression? Is there anxiety? Are there self-esteem issues? Did you just go through a breakup? Is there a life change? I mean, we can go on and on. And so I would recommend going to a licensed mental health professional, figuring out what is the cause of this? What are the symptoms? What is the root cause? How is it negatively affecting you? And then after that, coming up with a treatment plan. And that may include psychotropic medication, and it may not.
Awesome. Well, listen, Dr. Lina, thank you so much for being here with me. I am so excited to have you part of Sessions with Paola. And where can people find you? Because you are full of amazing information. And I just love you. So where can people find you? How can people follow you?
Thank you, Paola. So I am on Instagram. My Instagram account is Rise Psychological Services. That's the name of my private practice. So you can find me on Instagram. I also have a YouTube channel where I post all my Misdiagnosis Mondays. That is also under Rise Psychological Services. Or check out my website. I also have some webinars on psychopaths and malingering and some other topics at www.risepsychological.com. Thank you so much for having me.
Awesome. Well, guys, it was beautiful to spend a couple of minutes with all of you. And remember, if you haven't subscribed, please subscribe to my channel, Sessions with Paola. Thank you again y bienvenidos.